And on Monday, we aired a report about the acute shortage of ready-to-use therapeutic food, also known as plumpy nut, a critical food supplement for children suffering severe malnutrition in the northern region. We're receiving some good news today. UNICEF has delivered about 4,000 boxes of plumpy nuts to the Ghana Health Service in the northern region for onward distribution into areas worst affected by the shortage. An investigation by JoyNews revealed that the Ghana Health Service has not supplied the nuts to the region for the past 3 months. Here's the report we brought to you earlier.
This image looks like those out of a refugee camp, or worse, a war-torn country. A heavily malnourished child desperately crying for help. He looks so emaciated, you can even count his rib bones.
The upper arm circumference is 9.5, so it means the child is severely malnourished. The child is wasting.
Baby Abdul weighs 6 kilos, way less than what a 1.5-year-old baby like him should be weighing. Abdul is just one of many stunted children who have been brought here to the health center in Leposi for ready-to-use therapeutic food, otherwise known as plumpy nut. But there aren't any here. The critical lifesaver for children like Abdul suffering stunting ran out here more than 3 months ago, and the Ghana Health Service is yet to supply them. Ma Monimbe is Abdul's mother.
Some of the children are born malnourished. And in this area, when you give birth, we get pregnant early again. So a child would be 3 months and the mother would get pregnant. So we can't breastfeed, and so they get malnourished.
These plumpy nuts could mean the difference between life and death for hundreds of children suffering acute malnutrition in communities like Leposi. They've already done 3 months of wait, and as the clock ticks, nobody knows how many more days they would have to wait. This small town in the Nanumba North District is one of the towns with the highest malnutrition numbers in this area, recording at least 3 cases of stunted children every month. Daniel Al-Hassan, the nurse here, says time is running out for the children.
My fear is that if we don't get this plumpy nut in time, most of the children will experience a severe form of malnutrition. These children, when they are malnourished, their immune system suppresses. So any little infection takes the child away. Something like common malaria can lead to death.
The most affected are the underones and are pregnant women.
Dr. Stephen Dadia is the district health director for Nanumba North. He says the shortage is a regional crisis.
For the past 3 months, we could take delivery of over 50 cartons of the plumpy nuts. But as I speak to you now, 2 weeks ago when we went to Tamale, one made a request. We had only 4. It is a regional-wide issue. It is not just Nanumba North.
Several lives are dependent on the supply of these plumpy nuts, and that must be soon rather than later. Justice Baidu, JoyNews, Leposi.
And as we indicated, there's been some good news. UNICEF is producing or providing some 4,000 pieces of that need a nutrition. I have in the studio with me a nutrition specialist, Lillian Sillinger. She's with the UNICEF Ghana. You're welcome to the studio.
Thank you.
So tell us a bit about this distribution that first of all, we understand that there was this shortage because of lack of donor support. Is that correct?
Yes, it is true.
How bad is the situation, would you say?
It's very bad. UNICEF mobilizes resources from various donors. Okay. So since Ghana became a lower middle income country back in 2010, it has become increasingly difficult to mobilize resources for Ghana. So the last time we got a contribution for the program on nutrition was 2012. Wow. And that's what we have been using in the last 5 to 6 years. So in 2016, that grant came to an end. And so since 2016, it has become increasingly difficult for UNICEF to mobilize additional resources. And so our supply of these therapeutic foods have gone down a lot.
4,000 boxes you just released. What had to go into getting those 4,000 boxes?
In terms of
the 4,000 boxes that you've just released to be sent to the northern region.
Yes.
What went into it? Is this part of the 2012 grants that you had received already?
No. When we heard about the reports of shortage in the last 6 months of last year, somehow we managed to mobilize some resources, but only for 4,000 cartons, and that's what we have used to buy what we have supplied now.
Okay. Going forward, is there going to be any more provisions from the UNICEF?
Going forward, our effort is working with the government, because we cannot continue, relying on donations. They come, they don't come. Meanwhile, these children are there and they need to be supported. No child should be left to die, and IUTF is a life-saving commodity. So our effort now is to continue working with the Ghana Health Service so that IUTF becomes part of their list of essential commodities, and then they can supply the health facilities more reliably.
We understand that there are options that we could explore locally. How has the Ghana Health Service, in collaboration with yourself, UNICEF, collaborated to get those in charge of the distribution of this plumpy nuts to explore what we have locally, so that they can, because they're equally nutritional, aren't they?
Yes. Okay, so you see, the issue of malnutrition, we tackle it from various angles. The best way is, of course, to prevent malnutrition from happening in the first place. So then you don't have to spend on a lot on the IUTF. So UNICEF has been working with the Ministry of Health, Ghana Health Service, for a long time. And our focus has been on preventing malnutrition. Our efforts on promoting breastfeeding. Breastfeeding is very, very important the first 6 months. And then when they introduce locally available food at 6 to 8 months, we have been working with Ghana Health Service to support mothers so that they can give the right foods, with the right frequency, variety, and so on. In Ghana, there are a lot of suitable foods that can be used to prevent
malnutrition. What are some of the examples you have?
I remember poto, which most people talk about. And also these small fish like 1 man thousand.
Okay.
That's a very, very good small fish that they can use to pound, make fish powder, and give to the children. If they give that, regularly, they will help to prevent malnutrition. But you see, from the surveys that have been done, it shows that at 6 to 8 months and going forward, the children are just being given cocoa, the carbohydrate.
Right.
They need to be given a variety of food. And in many households, they do have these foods. but it is not prepared in a way that these young children can take them. And the second point I want to also talk about is how they care for the child, because you know a child can get malaria, can get diarrhea, they can get acute respiratory infections. It's very important that they take them to the appropriate health facility to get medication.
But that's if those facilities are available. I mean, in the northern parts, which is where we're seeing this shortage, for example, most of them are in remote areas where they don't have access to healthcare facilities. So your advice then would be to focus more on some of these foods, like you're suggesting, that would be good for the children.
Feeding is important. Management of infections is also important. So the policy of the government to promote having chips in every electoral zone will help to bring the services closer to the people. But in addition, of course, nutrition is really, really key. And I think this is something that we need to emphasize. As many people as possible need to talk about this. It needs to become, you know, a national agenda issue to talk about malnutrition, to talk about how to prevent it. Because a lot of times also people don't believe that when the child is getting malnourished, they don't believe that it's to do with food. They think about spirits, you know, and then they start getting help through the spiritual means, traditional healers, and so on. So that is not really very helpful for the child. They just deteriorate until they get to the stage of the children that you are showing us on TV. So if people get to understand this, you know, it's a slow process. They develop through a slow process. They need to understand that they need to breastfeed, give a variety of foods, the nutrient-rich foods, you know, not only to prioritize older members of the family, but the young children. These are the ones that need to get the best portions of nutrient-rich foods.
In that case, is UNICEF, and this is my final question, is UNICEF engaging in any sort of education programs, you know, in these remote areas to help the parents who take care of these children to know?
Okay, so the way UNICEF operates, we are not an implementing organization. We work with the government, and specifically the Ghana Health Service, because they are the ones who provide services in this country. So we work with them to develop capacity of the health workers so that they have the knowledge. They are able to support the mothers, and you know, they are able to identify malnutrition at an early stage before it becomes worse, and like that. So, and also we work with civil society organizations who complement the services that the Ghana Health Service is providing to the public.
All right. So for now, 4,000 boxes have gone to the north. We're not sure if any more boxes are coming anytime soon.
I mean, we have a lot of problem mobilizing resources for Ghana as a lower middle income country status. So our focus now is to work with Ghana Health Service and explore government investment in this program. They can start from somewhere and then move on.
So far, are you seeing any promising investments in that regard?
Okay, we at least there is dialogue. The fact that they allowed the local company that is producing IUTF in Ghana to be established is a step forward, because then it means IUTF is available in Ghana and the government can buy from that source. And besides that, UNICEF, our supply division, the one that helps us to source these items, has been in touch with the local manufacturer so that they get to know the standards for producing IUTF. It is commodity that requires safety standards, very, very careful safety standards. So UNICEF has been in touch with that company.
Okay. What company is that?
Project Peanut Butter. They are based in Kumasi.
So they are producing some of these, so we don't have to...
They have started.
They've
yes,
started.
They have started.
So all government will have to do is to buy from them?
What is needed are the resources, and that is where we should focus this conversation on.
Thank you very much for coming. Lillian Selenge is a nutrition specialist with UNICEF Ghana, helping us to understand what's happening. So the good news is that now children in the north won't have to suffer malnutrition, which, well, subsequently could lead to death, but they are getting this support. And hopefully the company in Kumasi that's producing these will also, government will turn their attention there so they can produce for the entire country.